If a tooth is lost due to trauma or disease, the space left should be filled so that surrounding teeth don't drift out of position. One option to close such spaces may include a fixed dental bridge. To prepare for a dental bridge, after giving you a mild anesthetic to numb the teeth and make you comfortable, your dentist will prepare the teeth on either side of a space with a very efficient diamond bit. Once the teeth are prepared, your dentist will then use either a putty-like material or a digital scanner to take a precise impression of the prepared teeth. The teeth are then covered with a temporary bridge made of a quick-set acrylic material. The temporary bridge will serve to protect your teeth and gums at the bridge site for the time that your impression is sent to the dental laboratory to fabricate your new custom bridge. On your second appointment, your temporary bridge will be removed, and the final fixed bridge